Debt collection is also another burdening process for healthcare consumers, especially when hospitals or third-party agencies decide to sue. More than a quarter of the 100 most profitable hospitals in America sued patients over unpaid medical bills in the years between 2018 and 2020, with 26 of the hospitals accounting for over 39,000 court actions filed. Most medical debt collection suits often end in default judgments in that the collector wins because the debtor did not show up. Some of the most common reasons as to why debtors fail to appear in court include logistical challenges such as the inability to secure leaves from work or childcare, not being aware of the lawsuit, failing to understand the lawsuit, and the inability to afford an attorney. The problem with default judgments is the fact that falsely or poorly documented cases cannot be challenged. Some of the most serious consequences to the debtor include jail time for failing to appear, wage garnishment, and seizure of property. Bank accounts and property are eligible for seizure in instances where medical debt has to be settled. In New York, 56 hospitals had placed liens on approximately 5,000 patients' homes for failure to settle medical debt around 2017-18. While funds from sources such as Social Security are protected from seizure, other monies can be repossessed by debt collectors and be used towards settling debt. Garnishments means that the debt collector takes money directly from the debtor's paycheck. In 2014, 4 million Americans had their wages garnished due to unpaid debt, which mostly included medical debt. The courts allow debt collectors to take up to 25% of someone's earnings to settle their debt, or the amount by which an employee's disposable earnings are greater than 30 times the federal minimum wage, which sees even low-income earners being affected. Garnishments reduce households' wages to as low as approximately $217 a week. It is illegal to jail people for failing to pay their debt, but 44 states allow jail time for individuals who fail to appear for debtors' examinations or fail to adequately support court processes, such as providing financial information for the relevant reasons and processes. Unpaid medical bills appear to be less severe than they actually are for a number of reasons. For instance, few medical debts that go into collections are actually paid, since rarely do customers divert the payment of other debts in collections to service medical debt. Most medical debts disappear from credit records within 2 years and way before they are actually removed from reporting agencies, with the low persistence implying that their damage to credit scores could be minimal at best. Medical collections have proven to have minimal impact on the payment of future debt, especially because of the unpredictable nature of how medical debt is incurred. As a result, some credit score models downplay the impact of medical debt on their recent scoring versions. All the reasons for medical debt not being perceived as serious boil down to the limited recourse that debt collectors have. Considering the fact that medical care is not an asset that could really be repossessed, even though it is important in the pursuit of wealth, unlike other forms of debt, access to healthcare services in future isn't entirely affected by past payment records. The fact that payment of medical debt has some degree of uncertainty implies that some collectors have reservations spending a lot of resources in the pursuit of judgments that could lead to the declaration of bankruptcy without them getting paid. National credit reporting agencies are for-profit entities that collect and compile consumer data, with the objective being highlighting their creditworthiness. Medical collection agencies provide patient data to these reporting agencies as an approach to pressuring them to settle their debt by making it harder to qualify for credit and loans. Very few credit models account for the unpredictable nature of medical debt, thereby weighting medical and non-medical debt equally. Some of the most popular ways credit reporting agencies are changing how medical debt is perceived include removing fully paid medical debt from credit reports. Unpaid medical debt will not be added onto credit scores until a year after the debt went into collections, and medical debt of less than $500 will be removed from credit reports. These steps do not absolve patients of their responsibility to pay their debt, but they reduce the burdens associated with bad credit due to medical debt. Consumers are also provided with a unique opportunity to negotiate bad debts. While consumers might be happy with the steps taken by reporting agencies to caution them against poor credit scores, the collections industry is not exactly happy. Collectors, who include healthcare providers as in the case of in-house collection, argue that patients or debtors will be unwilling to pay their debt because of the minimal impact on their credit, thereby raising the financial risk of insurers and healthcare providers. Collectors' arguments against reducing the effect of medical debt on scores are based on the fact that patients are more willing to settle their medical debt if the possibility of legal action, poor credit scores, or financial penalties looms. Thus, removing the pressures and penalties related to medical debt non-payment reduces patients' commitment to payment, especially those who cannot afford. The measures by the reporting agencies are projected to reduce the revenue of players in the collections industry by between 30 and 40%. While 2/3 of medical collections will not be reported to the relevant credit score-related agencies, low-income individuals, especially blacks and Hispanics, will benefit less.